Nephrotic syndrome is an renal disease condition Look at this picture, shows that kidney, nephron, glomerulus damage, detail going on. Introduction. Nephrotic syndrome is a kidney disorder characterized by high protein loss in urine, low blood albumin level, high blood lipids, and swelling, edema. This syndrome results from damage to the filtering units of kidneys, glomeruli, leading to excessive protein leakage. A definition. Nephrotic syndrome is a kidney disorder marked by high levels of protein loss in urine, leading to swelling, low blood albumin, and high cholesterol. It results from damage to the glomeruli in the kidneys and requires management to prevent complications such as infections and kidney failure. Types. 1. Primary nephrotic syndrome originates from kidney disease, mainly glomerular diseases such as minimal change disease MCD, focal segmental glomerulosclerosis FSGS, membranous nephropathy. 2. Secondary nephrotic syndrome arises from systemic diseases that affects the kidney such as diabetes mellitus, lupus, erythematosus, amyloidosis, and infections, hepatitis B, hepatitis C, and HIV. Causes. A primary causes directly affects the glomeruli. 1. Minimal changes disease. 2. FSGS. 3. Membranous nephropathy. The secondary causes underlying systemic diseases. 1. Diabetes mellitus. 2. Infections, hepatitis B, C, and HIV, SLE, and certain medications, NSAIDs, penicillamine. 5. Cancer. Hodgkin lymphoma. Risk factors. 1. Age. More common in children, often minimal change disease, and older adults. To gender, high incidence in males, particularly for minimal change disease. 3. Genetic factors. Family history of kidney disease can increase susceptibility. 4. Systemic diseases, conditions like diabetes, lupus, infections. 5. Medication use, long term use of certain medications, example NSAIDs, antibiotics. Complications. 1. Infections due to loss of immunoglobulin in urine. 2. Thrombosis, increased risk of blood clots, especially in the renal veins. 3. Kidney failure, progressive kidney damage, which may lead to end stage renal disease. 4. Malnutrition, loss of protein can lead to poor nutritional status. 5. Edema, severe fluid retention causing swelling in the lymphs, abdomen and face. Pathophysiology. Nephrotic syndrome results from glomerular damage, making the glomerular basement membranes more permeable to proteins. This leakage of proteins into the urine causes hypoalbuminemia, which reduces oncotic pressure. Leading to fluid accumulation in tissues, edema. Additionally, the liver compensates by increasing lipoprotein production, leading to hyperlipidemia. Here is the step by step pathophysiology of nephrotic syndrome. 1. Glomerular damage. 2. Increased permeability of the glomerular basement membrane. 3. Massive protein loss in urine. 4. Hypoalbuminemia. 5. Edema formation. 6. Liver compensation and hyperlipidemia. 7. Hypercoagulability and increased risk of thrombosis. 8. Immune dysfunction and increased infection risk. 9. Progressive kidney damage. Persistent proteinuria and glomerular injury can lead to chronic kidney damage, potentially progressing to chronic kidney disease and end stage renal disease if untreated. Signs and symptoms. 1. Edema, puffiness around the eyes, ankle and feet. 2. Proteinuria, foamy urine indicating high protein content. 3. Hypoalbuminemia, low albumin levels in the blood. hyperlipidemia, elevated blood lipid levels. 5. Weight gain due to fluid retention. 6. Fatigue and weakness due to protein loss and nutritional deficit. Diagnosis. 1. Urine analysis. High protein levels, lipiduria and cost in urine. 2. Blood tests. Low serum albumin, high cholesterol and creatine levels. 3. Kidney biopsy for definitive diagnosis and identifying underlying cause. 4. 24 hours urine collection measures protein excretion. Nursing diagnosis. 1. Fluid volume excess related to edema. 2. Risk for infections related to protein loss and reduced immunity. 3. Imbalanced nutrition less than body requirements related to proteinuria. 4. Fatigue related to malnutrition and fluid retention. Management. Medical management. 1. Diuretics manage edema. 2. ACE inhibitors ARBs reduced proteinuria and manage blood pressure. 3. Immunosuppressants, corticosteroids, cyclosporine for immune mediated cases. 4. Anticoagulants prevent thrombosis if risk factors are present. 5. Statins for hyperlipidemia management. Nursing management. 1. Monitor fluid balance, record intake and output, monitor daily weights. 2. Edema management, elevate limbs, provide skin care. 3. Dietary management, high protein, low sodium diet. 4. Prevent infections, maintain hygiene, assess for infection signs. 5. Patient education, importance of medication adherence and lifestyle changes. Treatment. 1. Medications, diuretics, corticosteroids, ACE inhibitors and immunosuppressants, anticoagulants. 2. Dietary modifications, low sodium, adequate protein, fluid restriction if needed. 3. Lifestyle changes, regular exercise, avoiding alcohol and smoking cessation. Psychosocial medicine, one emotional support, counseling and psychological support as chronic illness can impact mental health. To support groups, engagement in nephrotic syndrome support groups to enhance coping skills. 3. Patient and family education, educating about disease management, dietary adherence and self monitoring of symptoms. Prevention, 1. Control risk factors, effective management of diabetes, hypertension and other systemic diseases. 2. Healthy lifestyle, balanced diet, regular exercise, avoiding nephrotoxic medications. 3. Regular checkups for high risk patients to detect early signs of kidney damage. In conclusion, nephrotic syndrome is a serious kidney condition that significantly impacts quality of life and requires a multifactored approach for effective management. With appropriate medical treatment, lifestyle changes, and preventive measures, patients can manage the symptoms and reduce the risk of complications. Thank you. Have a nice day.